From open enrollment to drug plans, navigating Medicare can be very challenging. We are talking to the author of a book that takes the confusion out of making Medicare choices and breaks it all down in a user-friendly format. It's called Making the Most of Medicare, a guide for baby boomers, 9th edition. Dr. Katie Votava joining us now with more. Thanks so much for being here.
Thank you for having me, Patrick. It's great to be here.
You've made a career in healthcare, from a nurse to a PhD, and you are certainly a specialist in this subject matter. So let's get right to it. It's open enrollment now. What do people need to know?
You're right. It is open enrollment right now for Medicare, and that goes through December 7th. And everyone in Medicare who has a Medicare Advantage plan or prescription drug plan has the opportunity and should look at their coverage for next year, make sure it's still going to work for them in the most cost-effective way. And there are a lot of ways that they can do that, but they really need to focus on it now. I think that's the most important thing. Don't wait till December 6th.
By some estimates, including yours, 95% of people who are on Medicare pay too much for their prescription drug prices. Talk to us a little bit about that.
Here's the problem, that the vast majority of people on Medicare overspend. And the most recent study showed it's at least $1,000 a year out of pocket, and for some people it's much more, and $1,000 is a lot of money. And how they do that is that people often look at the premium they're being charged as opposed to the benefits. So what we recommend at Good Care is that you shop. You become a smart shopper and put your medications. There's a really good way to do that in Medicare.gov. You can go to that website. It's free to use and it's confidential. And you can shop to make sure that your medications are covered at the best possible price and that they are all covered. Because if you don't do that, and then in January, when the plans you've lost your opportunity to get a new plan, and your medication either isn't covered or isn't covered most cost effectively, that is how people get into trouble. And don't assume that your coverage for this year in 2023 will be the same in 2024. Oftentimes there are changes that are not really apparent. The company will send you a notice about your premium, but not necessarily about what the coverage in terms of specific medications will be. So do your shopping.
So that's what you talk about in Medicare Advantage, that's Medicare C and Medicare D. Do you think that most people or a lot of people are intimidated by this process?
Yeah, people we find all the time are very intimidated. But I have a little slogan. If you can shop online for shoes, you really can shop for Medicare. And if you stick to some simple things, really, because Medicare is a very complex system, but make sure that your care providers are covered, like your physicians, you see a physical therapist, a counselor, where you get your supplies from, and your medications. And the easiest way to do that is to go to Medicare.gov, and you can do that shopping. Also, there are people in every community who can help you cut through the mustard and find out what's good for yourself. Or if you're a caregiver, you can do this remotely. Even if you have someone who's across the country and you are in the Chicagoland area, there are people that can help you, even in California or New York, figure out something for your family member. But you have to focus on the two most important things are medications and care providers. And make sure they're covered first before you think that, well, they're advertising all these additional benefits in Medicare plans, dental care, eyewear, hearing, and so on. That's all great, but make sure that your care providers and medications are covered, because first and foremost, it's health insurance. But you can do this, and like I said, if you can shop for shoes online, you can shop for Medicare.
And you can go to that site that you recommended, and then you can get out, and then you can go back to it tomorrow and pick up where you left off.
Yes, you can. Don't close your search window, because you'll have to put your medications back in. That's a little tip. Also, people who are already in Medicare, they could go to their own My Medicare account, which is part of Medicare, and it will auto-populate your prescription medications and make it easier for you. So double check that list. And again, that's something that the person on Medicare can do, or their family member could help them do that as well.
So with final 30 seconds here, you can't underscore enough how important it is to get the prescription drug aspect to this and the insurance end, because obviously statistics show as people get older, they need a little bit more care. They need to take more medicine to stay healthy.
Right. You're absolutely right about that. And that's why I take the time now. In our book, we have a little worksheet that helps you organize the information that you need. Have that handy. Make sure you write down very exactly what the medications are, or use that function in My Medicare. It will auto-populate for you, makes it easier. and then do your shopping, as well as there are some resources in every community called the State Health Insurance Program. You can Google it for Chicago, and you can Google it for the state of Illinois, and it will tell you who in your area can help you individually. Again, start now, because the services available through the SHIP program start to get filled up, and you don't want to wait. You want help now so that you can make your right decision for January 1st next year.
Very good. All good stuff. I wanted to get into telehealth, but we're going to have to do that next time. Again, The book is Making the Most of Medicare, a guide for baby boomers, 9th edition. You can get more info at goodcare.com, where you can get 20% discount. You got to use the code WGN20. You can also follow Dr. Katie on social media. Good doctor. Thank you for your time.
Thank you, Patrick.
We'll be
My
right
pleasure.
back.